Hello everyone, my name is Andrew Hoffman. I am a licensed financial advisor and also a licensed insurance representative for the last 19 years. Today what I want to do is I want to educate you about the annual enrollment period. This is the time of year, typically in the fall, where you can make changes on your Medicare programs that will impact you for the upcoming year. My main goal for today is for you to be in the know about what these changes are and how you can maximize them to your advantage. Where we want to start is actually with the ABCs of Medicare. Medicare can be very confusing. There's always different parts to it: Part A, Part B, Part C, Part D. A lot of confusion about what the different types of coverages are. So let's review these. First of all, there is traditional Medicare, also known as Medicare Part A, hospital coverage, and Medicare Part B, medical coverage. Medicare came out in 1965, and this is really the foundation and the pillars for the Medicare system. A couple of decades later, they created Medicare Part C, also known as Medicare Advantage and Medicare Advantage prescription drug plans. Now, you cannot have both of these. You either have traditional Medicare A and B, or you have Medicare Part C. Medicare Advantage is part of the Medicare system. The difference is, instead of the government controlling your health care benefits, A and B, you're actually allowing an independent insurance company to control your Medicare benefits. And last but not least is Medicare Part D. This is the prescription drug plans. The Medicare Modernization Act of 2003 is what enacted this, and the plans finally came into being in 2006. So in January 1st of 2006, we finally had prescription drug coverage offered by the Medicare system. Now, who is impacted by the annual enrollment period? It's basically everybody. All Medicare beneficiaries who are 65 years old or older can take part in these changes. Also, beneficiaries who are under the age of 65 and are on the Medicare system due to disability or the fact that they have end-stage renal disease. So if you are on Medicare, whether above the age of 65 or below the age of 65, you have the ability to take advantage of these enrollment period where you can make changes. When is the annual enrollment period? Well, it actually takes place from October 15th till December the 7th. Now, there's also a less familiar time. It's called the Medicare Advantage disenrollment period. It's from January 1st to February 14th. However, for this training today, we are going to focus on the annual enrollment period. That's what impacts people the most. Once again, October 15th till December the 7th. Now, what can you do during the annual enrollment period? There's actually several different things. We're going to focus on the four major things. If you are on traditional Medicare, whether you have Medicare all by itself, A and B, or if you have a supplement to complement your traditional Medicare, you have the ability to change to a Medicare Advantage plan. So you'll be going from Medicare A and B to Medicare Part C. You also have the ability to do the exact opposite. If you're on a Medicare Advantage plan, you're not satisfied, or you would like to explore what traditional Medicare can do, you can go from Medicare C to Medicare A and B. However, note, Medicare A and B is great. It does not pay the whole bill. It will leave off some heavy deductibles and co-insurances that could actually leave you vulnerable to thousands of dollars out of your pocket. That's why most people would explore a Medicare supplement. That way they can have more comprehensive coverage. You can also change Medicare Advantage plans. You can go from one Part C to another Part C. And last but not least, you can change drug plans. You can go from Medicare Part D to another Medicare Part D plan. Now, one of the most common misconceptions that folks have is that this is the only time of year that they can change their Medicare supplement. That is incorrect. If you are on traditional Medicare and you have a supplement plan that complements that and pays what Medicare doesn't pay, you can actually shop and change Medicare supplement plans any time of the year that you want to. You are not restricted to the annual enrollment period. Now, who is going to be impacted? Well, if you're in this demographic, I want you to understand that you are going to be inundated with solicitors from either insurance companies or insurance agents wanting you to make changes. One thing to keep in mind, you do not have to make a change unless the carrier you are with is leaving the market where you live. So if a Medicare Advantage or prescription drug plan is exiting your county or your zip code, then you would need to make a change. But other than that, you don't have to make a change. Should you make a change? Well, that depends. Maybe you've had a health event where you're taking more prescription drugs, or maybe your doctor is no longer in the network for your Medicare Advantage plan, then yes, I would definitely make a change in those particular situations. But you always have the ability to shop and compare who you currently have with the new companies. There's new companies that will enter into your market possibly every year, and the carriers that are currently in your market, they can change their premiums, they can change their co-payments, and they can change the tiers for their prescription drugs. I want you to be in the know. Understand that you don't have to make a change, but you should at least compare what's available to you in your current area. Be careful. Less expensive is not always better. Just because a plan has a 0 monthly premium doesn't mean it's the right plan for you. Medicare Advantage plans can vary in premium and out-of-pocket expenses. So you might have a premium that is 0 on your Medicare Advantage plan, but your out-of-pocket expenses could be higher. Your coverages could be totally different. Medicare drug plans vary in premium and out-of-pocket expenses. Totally depending upon your prescriptions might dictate what plan is best for you. So just because you have a premium on a Medicare prescription drug plan that's $18 a month doesn't mean it's the best value. You could actually have a higher premium, one that would be $25 a month, but it would cover your particular prescription plans better. Some Medicare drug plans are great for generic medications, but awful for name brand. So make sure that you're getting the best value for your plans. This will actually be a video that we will talk about in the future, is how to compare Medicare Advantage plans and how to compare Medicare drug plans. Medicare Supplement Plans are more standardized. They're lettered also. Plans F, Plans G, and Plans N are your most popular plans. Plan F will no longer be able to be sold after January 1st of 2020. However, if you're on one of these plans and you want to compare your premiums, you have the ability to do that. It's a lot easier to shop and compare Medicare supplement plans. If you have a Plan G, all you're doing is you're just shopping different carriers for different premiums. One Plan G with one carrier is exactly the same as a G plan for another carrier, but the premiums can be totally different. Your premiums could actually vary anywhere from $5 a difference to over $100 difference for the exact same benefits on your Medicare supplement. Let's talk about the changes that you can make in the annual enrollment period. These are the most common changes that you can make. One of those is to change to Medicare A and B. So if you're on a Medicare Advantage plan, one that either has prescription drugs or one that doesn't, and if you'd like to change to traditional Medicare. Now, typically, if you're changing to traditional Medicare, the idea is to also have a Medicare supplement to pick up and pay the gaps that Medicare doesn't pay. Medicare is good, but it does not pay the whole thing. It leaves off high deductibles and co-payments, and that's why most folks have a Medicare supplement. So if you're on a Medicare Advantage and you're not satisfied with the coverages or your benefits there, and you want more comprehensive coverage, you want to go to a Medicare supplement, this is that process. The first step is you want to apply with a Medicare supplement carrier. Medicare supplement carriers, after your annual enrollment period or your special enrollment period, they don't have to accept you. They can deny you. They'll actually ask you questions to see if they will accept you with the Medicare supplement company. They're not too difficult, so don't be scared about applying for a Medicare supplement. There's no harm in doing so. If they turn you down, that's not a big deal, because there might be another company that will accept you. So just because you get denied by one Medicare supplement doesn't mean that you'll get denied by all the carriers out there. It's where it's important to understand a licensed broker, an independent broker that works with several different carriers will be the person or the individual that can provide the most options available for you. If somebody just works with one Medicare supplement company, they're limited to just that carrier. Work with someone who works with several different carriers. Once you get approved for your Medicare supplement, you want to make sure that the coverage starts on January the 1st, because your coverage in your Medicare Advantage plan will stay in effect till December 31st of that year. So you want to have the new coverage start on January the 1st. Now we are in 2019, so your coverage would end on December 31st. So we want to have your supplement coverage start on January the 1st. Now, you still have your Medicare Advantage plan. So we need to make sure that we exit out of that Medicare Advantage plan. And here's the simple process, is you enroll in a Medicare prescription drug plan. So during this annual enrollment period, you're going to apply for a supplement, get approved, have your coverage start on January the 1st. Also, during this annual enrollment plan from October 15th till December the 7th, you want to enroll in a standalone prescription drug plan. This will automatically disenroll you in your Medicare Advantage plan. So you enroll in Part D. Now they know that you no longer need Part C, so you disenroll. Now, effective January the 1st, you will have your new coverages starting and your old coverage ending. You will have your Medicare start on January 1st, your Medicare supplement start on January the 1st, and also have your Part D plan start on January the 1st. Now, if you want to do the opposite, you would like to enroll in a Medicare Advantage plan and you're on traditional Medicare, maybe you're on a prescription drug plan also. Let's walk through those steps. First of all, apply with the Medicare Advantage company that you want to go with. They will accept most anybody. There's just very few chances that they will not accept you on a Medicare Advantage plan. So make sure you understand those rules that you will be accepted onto the Medicare Advantage plan. Once you apply for the Medicare Advantage plan, that new coverage will start on January the 1st of 2020. Some Medicare Advantage plans have prescription drug coverage, so you're up and running with your health care and also with your drug coverage. Some of those just have Medicare Advantage coverage, and in that case, you would need to also enroll in a standalone prescription drug plan. However, if you just had traditional Medicare, a supplement, and a drug plan, when you enroll in Part C, it will automatically disenroll you from your Plan D. So if you enroll in a Medicare Advantage with prescription drug, it will kick you out of your standalone prescription drug plan. Then all coverages will start on January the 1st. Make sure you cancel your Medicare supplement coverage. There is no automatic system to disenroll you. This is an independent insurance company that you had your coverage first. They will continue on with that coverage and continue to bill you. So make sure that you cancel out your coverage effective January 1st, 2020. No matter which side you decide to do, make sure that you have your new coverage in effect to start on January the 1st before you disenroll from your coverages. So that will conclude our how to disenroll from a Medicare Advantage and enroll into Medicare, and how to disenroll from traditional Medicare and enroll in a Medicare Advantage. You always want to kind of compare the different types of plans. And so we're going to have some upcoming videos to educate you on how to compare prescription drug plans. Maybe you had a health event this year and you're taking more expensive medications. We want to shop all those plans, make sure you're getting your best value. Maybe you've got one Medicare Advantage plan and your doctors have left that network, or you want to see if there's a better value for you. We'll teach you how to compare Medicare Advantage plans. And we'll also show you on how to compare Medicare supplement plans to make sure that you're getting the best bang for your buck. I want to thank you for being a part and participating in this video today. Once again, my name is Andrew Hoffman. If you'd like to visit our webpage, it is comparemedigapcompanies.com. And you can also email us at info@comparemedigapcompanies.com. Thank you and have a wonderful day.